Welcome to our deep dive today. We're going to be exploring the world of mobile clinics in Africa,
Oh, cool.
specifically how they're bringing healthcare to communities that really need it most.
Okay. Yeah.
We're focusing on this podcast called Mobile Clinics 101 by RescueRide Africa,
Okay.
and we've got some fascinating research from Niger to add into the mix too.
Awesome.
So buckle up, because we're going to be discovering how these clinics on wheels are changing lives.
Yeah, I think it's a topic that really highlights just how much power innovation has in healthcare.
Right.
We often think about like big hospitals and advanced technology, but sometimes like the things that have the most impact are the simplest solutions, the ones that meet people right where they are.
Yeah, exactly. And that's where mobile clinics really shine.
Totally.
So let's start by setting the scene a little bit. What's the healthcare landscape look like in many parts of Africa?
Well, imagine this. Okay, so you live in a place and the closest health facility is a full day's walk away. That's the reality for a huge portion of the population.
Yeah.
For example, in Niger, a study actually found that less than half the people can reach a health center within a 5-kilometer walk.
Wow.
And that's before even considering like flooding during the rainy season,
Yeah.
which can make those journeys way longer and more dangerous.
It's hard to even grasp what that means for just daily life. Like, what if you get a fever?
Oh, yeah.
That could be life-threatening if you have to go on this huge trek to get treatment.
Absolutely. And that's where the mobile clinic model really shines because it brings the healthcare to the people,
Yeah.
to those most isolated and underserved.
So paint a picture for me. What are we talking about when we say mobile clinic?
Okay, so picture like a fully equipped medical facility,
Okay.
but it's on wheels.
Oh.
We're talking vehicles that are outfitted to provide a range of services like basic checkups, first aid vaccinations, prenatal care, even health education. It's like a mini hospital on the move.
Okay, so we're not just talking about ambulances taking people to the hospital. These are actually providing the care in the community.
Exactly. And one of the things that makes them so effective is that they can be adapted to the needs of the regions they're serving.
Right.
The RescueRide Africa podcast pointed this out.
Okay.
They can be customized with equipment and staff that's relevant to wherever they are.
So it's not a one-size-fits-all approach. They're tailoring the services.
Yeah.
That's got to have a huge impact on the ground.
It really does. And we can see this in action in the Diffa region in Niger.
Okay.
This area has a ton of challenges, from armed conflict to flooding, which obviously makes accessing healthcare even more difficult.
Oh.
But research has shown that mobile clinics...
Wow, that's incredible.
Yeah.
But what does that actually look like in terms of services? What kind of impact are they having?
Well, they provided over 12,000 treatments for things like malaria, respiratory infections, even malnutrition. They were also doing really crucial work like vaccination catch-up campaigns for kids in these remote areas.
Right.
And providing antenatal care, which is essentially care for pregnant women.
I know that access to prenatal care is a major issue.
Oh, huge.
In many parts of the world, it can mean the difference between a healthy pregnancy and complications. So having mobile clinics do that it's a big deal.
It is. And let's not forget family planning services, which empower women to make choices about their reproductive health.
Right.
These are often overlooked, but they're vital services that mobile clinics can bring directly to communities.
It sounds like mobile clinics are having this real tangible impact on people's lives.
Yeah.
But I'm curious, did the research highlight any challenges or limitations?
Yeah, of course, no solution is perfect.
Right.
For example, the study in Niger found a pretty low treatment rate. Among people who got health education from the mobile clinics, only about 28% actually sought treatment after.
That's interesting. Why would that be? You'd think if you're getting good health information, you'd be more likely to follow up.
Right. Well, it suggests that there are barriers beyond just access to information. It could be financial limitations, cultural beliefs, or even a lack of trust in the healthcare system.
Yeah, it sounds like more research is needed to figure that out and how to bridge the gap.
Absolutely.
Okay.
And the study also found that the impact on overall vaccination rates, while it was positive, it wasn't as significant as they'd hoped.
So they're reaching lots of people with the vaccines.
Yeah.
But not necessarily actually like moving the needle on those broader vaccination rates.
Exactly. And that raises the question of whether mobile clinics need to do more to work with local communities and build long-term trust. It's not just about like showing up with services. It's about making a change that lasts.
Right. Yeah.
Yeah.
Okay. So it sounds like building that trust and understanding the nuances of each community is really crucial
Yeah.
if these mobile clinics are going to be successful in the long term.
Mm.
But I'm curious, how do these clinics actually function? How do they operate?
Yeah.
What are the nuts and bolts of running one of these in these challenging environments?
That's where things get interesting. The RescueRide Africa podcast did a good job of breaking this down.
Okay.
The first thing is staffing is key. You need really skilled healthcare professionals
Mm-hmm.
who aren't just clinically competent, but also adaptable, culturally sensitive, and great communicators.
So it's like a very specific type of healthcare worker.
Oh, yeah.
They're not just treating illnesses, but also building relationships and working within all these cultural landscapes.
Exactly. They need to be able to get the community to trust them and explain medical concepts in a way that people understand.
Yeah.
And that's relevant to them.
Yeah, I imagine logistics must be a total nightmare.
Oh, yeah.
How do they keep these clinics stocked with medications and vaccines and equipment when they're traveling to some of the most remote places?
Right. That's one of the biggest challenges. It takes a lot of planning. Reliable transportation and strong partnerships. A lot of mobile clinics work with local governments and NGOs and even private sector organizations just to make sure they have a steady supply chain.
So it sounds like it's all about teamwork. Nobody can do this alone.
Absolutely. And that idea of working together is also seen in how they get funding.
Okay.
Some mobile clinics get support from the government or grants from international organizations, but others are trying new things.
What are some of the new approaches?
Well, some organizations are being set up as social enterprises,
Okay.
so they can generate some income through the services they provide, but they also give free or subsidized care to people who can't afford it.
Mhm.
Others are using microfinance initiatives or even crowdfunding campaigns to get the money they need.
Those are some really creative solutions.
Yeah.
It's amazing how they're finding ways to keep these clinics going, for the long term.
You're sure?
What about technology? I mean, we're living in a digital age, so I think that technology has to be playing a part even in these remote places.
You're totally right.
Yeah.
Connectivity can be a problem in some areas, but we are seeing more and more mobile clinics using tech to be more efficient.
Okay, give me some examples. How are they using technology in these remote clinics?
Well, one way is data collection and record keeping.
Mm.
They're starting to use mobile-based systems so they can keep track of patient data monitor inventory and even communicate with healthcare workers in the field
Okay.
and specialists in cities.
That makes a lot of sense. Having access to real-time data is so important for making good decisions, especially when resources are limited.
Oh, totally.
It's like you always know what the community needs.
Exactly. And as telemedicine becomes more common, even in places with limited resources,
Right.
we could see mobile clinics that can do remote consultations with specialists.
Wow.
Imagine someone in a small village getting expert advice without having to travel for hours.
Yeah, that could be life-changing for people who wouldn't be able to get that kind of specialized care.
For sure.
That's incredible.
Yeah.
It's amazing to see what technology can do.
Hmm.
But I also wonder about the potential downsides. Could technology actually make existing inequalities worse?
Yeah, that's a valid point. We have to be careful about things like data privacy and making sure everyone can use the technology
Right.
and making sure it doesn't leave some people out.
So it's not just about throwing technology at the problem.
Right.
It's about using it in a way that benefits everyone.
Exactly. It's about giving people the tools, not creating new problems.
Okay, so we've talked about all of the great things mobile clinics are doing.
Yeah.
But let's be real. They're still not as common as they could be.
Mm-hmm.
What are some of the biggest obstacles that are stopping these from being more widespread?
Well, keeping them going is always tough.
Right.
As we talked about, funding can be unreliable and relying on outside sources is risky, plus keeping staff is a problem.
Yeah.
It's hard to find healthcare workers who want to work in these tough conditions, and burnout is a real issue.
I can see how that would be demanding,
Oh, yeah.
both physically and emotionally, and being isolated in these remote areas can't be easy.
No.
So what are some ways to address these challenges? How do we make sure mobile clinics aren't just a quick fix, but something that actually makes a difference?
One thing some organizations are doing is training people in the communities to be health workers.
Yeah.
They get basic healthcare training and can kind of extend the reach of the mobile clinic.
So it's about building up resources within the community
Yeah.
instead of just relying on people from outside.
Right. And it also helps build trust because these community health workers are often people who are already known and respected.
Yeah, that makes a lot of sense.
Mm-hmm.
I'm also wondering about governments and people who make policy.
Yeah.
What can they do to help mobile clinics expand and be more effective?
Governments can play a huge role in creating policies that support mobile clinics.
Okay.
This could mean making regulations easier,
Mhm.
streamlining the approval process, and even giving incentives to organizations that run these clinics.
So it sounds like there needs to be recognition that mobile clinics aren't just a temporary solution.
Right.
They're a vital part of the healthcare system.
Exactly. And governments can also invest in things like better roads and communication networks,
Mm.
which would make it easier for these clinics to get to remote areas.
It's fascinating to see how everything is connected.
Yeah.
It's not just about the clinics themselves.
Right.
It's about having a whole system in place that helps them be successful.
And let's not forget about the bigger picture. These mobile clinics do more than just provide healthcare.
Right.
They often help communities develop as a whole.
Okay.
They raise awareness about health issues, empower women, and even create economic opportunities.
It's amazing how much of an impact something as simple as a clinic on wheels can have.
It really is. It shows how important it is to think about healthcare solutions in a holistic way.
Mhm.
It's not just about treating diseases. It's about addressing all the social and economic factors that affect people's health.
Okay, so we've covered a lot here.
We have.
From how the clinics work to the challenges and the opportunities. But there's still a big question. What does the future hold for mobile clinics?
Yeah.
Are they just a temporary fix, or are they leading the way to a healthcare system that's more fair and accessible?
That's a question that gets me excited about all the possibilities.
Mhm.
One area I see a lot of potential in is technology.
So we were talking about technology and how it could really change things for the better.
Yeah, it's got a lot of potential.
Can you kind of tell me what a more tech-focused future would look like for mobile clinics?
Okay, so imagine this. You've got these mobile clinics, and they're decked out with all these high-tech sensors and tools
Okay.
that can gather information in real time on everything from disease outbreaks to environmental stuff that affects health.
Wow.
And then they can use that data to provide better healthcare services and even predict health crises before they happen.
So it's like being proactive instead of just reacting to problems.
Yeah, exactly. It's about being one step ahead.
I like that.
And as AI and machine learning get even better, we could see them being used in these mobile clinics to help diagnose patients, make personalized treatment plans, and even connect with specialists in cities for real-time advice.
So even someone in a really remote village could have access to the same level of care as someone in a big city.
That's the idea, and it's not just about bringing the technology to these areas.
Correct.
It's about giving the communities the power to manage their own health.
Okay.
Think about mobile apps that can educate people about health. Let them keep track of their own health data and connect them with support networks.
It's all about putting that information and knowledge right in people's hands.
Exactly. And let's not forget about the potential for these mobile clinics to be centers for innovation in healthcare. We're already seeing drones being used to get medicine to remote areas,
Oh, wow.
3D printing to make medical supplies on the spot, and even portable labs that can run complex tests right there in the field.
It's amazing to think about how one mobile clinic could be this hub for all these amazing technologies.
It's pretty exciting, but we also have to be realistic about the potential risks and challenges.
Yeah.
We have to make sure the technology is used in a way that's responsible and fair, and that it doesn't make existing inequalities even worse.
We've talked about that before.
Yeah.
It's got to be about empowerment, not leaving people behind.
Right. We need to be aware of things like data privacy, making sure people understand how to use the tech, and making sure it doesn't benefit some at the expense of others.
Yeah.
It's a conversation that needs to happen alongside all the technological progress.
Okay, so we've talked a lot about these mobile clinics.
Yeah.
What's the key takeaway for someone listening to our deep dive?
I think the main thing to remember is that innovation in healthcare can come in many forms.
Right.
It's not always about big fancy hospitals and expensive machines. Sometimes the best solutions are the simplest ones. Ones that can adapt and meet people's needs right where they are.
It's about thinking outside the box and not being afraid to challenge how we've always done things.
Exactly, and it's also about recognizing the power of collaboration. Mobile clinics are most successful when governments, NGOs, private companies, and the communities themselves all work together.
It reminds us that we all have a part to play in building a healthcare system that's fair and accessible for everyone.
Absolutely.
Whether you're a doctor, a policymaker, an entrepreneur, or just someone who cares about global health equity, there are so many ways to get involved and support this movement.
This has been a really inspiring deep dive.
It has.
It shows that even with all the challenges out there, there are people finding creative solutions and making a real difference.
And it makes us think, If something as simple as a mobile clinic can change how people access healthcare, what other important services could be delivered in the same way?
Yeah,
Education, clean water, financial services, the possibilities are endless.
they are.
It challenges us to think bigger, to imagine a world where essential services are available to everyone no matter where they live or what their circumstances are.
It's a future worth working towards.
It is. Thanks for joining me on this deep dive.
It was my pleasure.